Yes, I was a South African by birth and worked there in a rural place as well. Always been rural, always been engaged in the whole of general practice, the whole of patient care. Within this service, our responsibility is to look at the patient's health before they fall pregnant, to try and counsel them in terms of what will give them the best chance of an optimal pregnancy. Then during their pregnancy, we have antenatal care, where we concentrate again on the health of the patient with her baby. Very important for us to be able to distinguish between the normal and when things become more challenging, where a patient requires to be upgraded to a higher level of service. I think the most challenging thing is the constant awareness of your responsibility of care, to be able to pick up in time when more is needed. The most challenging thing is to be able to change gears from dealing with the normal to dealing with something that's abnormal. We have unexpected challenges in obstetrics, and you have to be ready to address that at a moment's notice. I start early in the morning with our ward rounds in the hospital, and I would then from there on attend my general practice. And in between we run the antenatal clinic on a weekly basis, and then I have very frequent call-outs for whatever might befall the pregnant girl. It's not necessarily limited to deliveries, it's also, and mostly in fact, includes other aspects. A girl just has some anxiety or some concern about her pregnancy. And then of course the ultimate experience is the actual delivery at the end of it. It's a great place. It's a family hospital where we're very personal. We know one another by the name. We know our patients by name, their families, where they live, and we can truly exercise holistic care here. The thing that I enjoy most about obstetrics is how close you can get to a patient. When you care for that most valuable of what we have, I don't think one can get closer to a person than that. You form a long-term relationship, which I think is very unique. To be able to lift a baby on the operating table, if you've done a cesarean section, to be able to present the patient, the baby to the patient and her partner, even in the delivery suite. That sensation when we place a baby on mom's chest, to share in that absolute extraordinary joy and pleasure and satisfaction that a couple has when a little baby is born. To enjoy the journey. It's an extraordinary thing that men will never understand, but women experience to actually feel the life within you that you are producing. And you're only going to have it once, twice, if you're lucky, 3 times in your life, and it only lasts for a short time. And to try and overcome the little niggles by concentrating on that extraordinary, in a sense, miraculous thing that's happening within you.